That's a pretty poor shot. It used to be awesome.
Yeah, I know. I've had this terrible growing pain for about 4 weeks now.
It's still hurting you, eh? Well, you know what you should do? You should go see Dr. Khan. He's really good at this sort of thing.
Yeah?
Yeah.
His office is just
over
there,
here.
All right, man, let's go.
Go. How can I help you?
Hey, Doc, I've had this chronic growing pain for the longest time.
Okay. How long has this been going on for?
It's been going on for about 3 months now.
Okay. I'm going to palpate your groin. Get ready for this. Well, there was no abnormal bulge in your groin. So, judging from your history, I'd say it could be athletic pubalgia.
Okay, perfect. Thank you, Doc.
Athletic pubalgia. That is a tricky one. So many treatment options. But which one is the best? I don't want to go through all this evidence myself. I know! I'll get my class to do it for me. Alright, today we're going to learn about sports hernias. The lesson objectives are to identify 4 treatments for sports hernias and to evaluate which one is going to be the best one. So, a quick pre-test. What do you suppose the treatment options are for this condition?
I think I know. Isn't it just physiotherapy?
No, it's not. I mean, it's a safe place, but no, that's a bad answer. It's a safe place, it's a safe place.
Well, there's either surgery or no surgery, right?
Right, but it's a little bit more complex than that. There is, of course, the conservative treatment, and then there's laparoscopic surgery, open suture surgery, and open mesh surgery. So I hope you guys are focusing on professional collegiate athletes for finding information. Let's see what our first group came up with, the conservative approach.
Okay. Well, a sports hernia can heal itself. Therefore, the conservative treatment should always be tried first. It usually entails progressive resistance training and stretching of the muscles around the hip, pelvis, and lower abdominal wall. This non-surgical approach is usually guided by physiotherapy, and the athlete is provided with sport-specific exercises to do for around 90 minutes, 3 times a week, for around 2 months.
That's excellent. All right, let's go to group number 2. Why don't you tell us about open suture repair?
Well, the open suture repair is where a surgical team cuts open like a patient and sutures the rectus abdominis fascia back onto the pubis and the inguinal ligament. And by reattaching and tightening the muscle and tendons, at the point of insertion, this causes the hip to be more stabilized. And the best way to do this is to go about using a local anesthesia.
Thank you. Let's go to group number 3. Number 3, I believe you had open mesh repair.
The goal of open mesh repair is to strengthen the pelvis wall by placing a polypropylene mesh over the problem area and suturing it into place. This allows for tension release of the area, as the muscles do not have to be pulled back into place. The open surgery is performed under local anesthesia and with a 3 to 4 inch incision.
Thank you. All right, last but not least, group number 4. Group 4, educate us about laparoscopic mesh surgery.
Well, laparoscopic mesh placement is similar to open mesh repair, differing only by the fact that it is done through several small incisions instead of one larger one. It requires general anesthesia, making it slightly longer in surgical procedures than the other 2 surgical techniques. The mesh is attached to the anterior abdominal wall and Cooper's ligament by tacks or staples, and over time, tissue grows into the mesh, fixating it in place and strengthening the whole area.
Good. Now we have a good idea of what the possible treatments are. So let's assume that our patient is a collegiate athlete, let's say a soccer player, and he's been having debilitating groin pain for about 4 weeks. He's tried conservative treatment, but it's not working. So should he consider continue with the conservative approach, or should he take surgery? And if so, which surgery should he choose? Let's get to groups of 4 and let's discuss.